Hello everybody, in this video you are going to learn the risk factors for developing lymphedema. It's very important that you are aware of these factors because if you have this type of surgeries, it's good that you talk with your doctor and your physical therapy so you can prevent it. Okay, and lymphedema is a very common side effect after breast cancer treatment. 21% of women develop lymphedema. When they remove the lymph nodes in the area in the arm, close to the arm is going to get swollen, and also the trunk and the breast. Risk factors: Sentinel lymph node biopsy, where they remove 1 to 5 lymph nodes. The chance of getting lymphedema is like 5%. This is all based in evidence. If you get axillary lymph node removed, the chance of getting lymphedema is higher. Radiation, if you get radiation, or only radiation or combined with these two surgeries, the risk of lymphedema increase. But specifically, if you get radiation and the axillary lymph node dissection, both, the chance increased by 4 times. So pay attention to this, tell the doctor, talk with your physical therapist to help you to find the signs and prevent it. This is very important to know. If you get the lymph node removed, that one is associated with an early onset of lymphedema. So you will see signs earlier, or like I said, you can prevent it. When you get radiation, this is very important, the signs of lymphedema appear after 12 to 30 months of the breast cancer treatments. Please talk with your physical therapy if you are concerned about getting lymphedema. If you got this type of risk factors, it doesn't mean that everybody is going to get it, but it's very important that you are aware. And another factors are chemotherapy, obesity. If you have body mass index higher than 30, body mass index greater than 30 means that there is a higher risk of lymphedema. Okay, in summary, what are the risk factors? Lymph node removed could be by biopsy or in the axillary area. Second, radiation by itself or radiation combined with these two surgeries. And worse, with the axillary lymph node. Third, chemotherapy. Fourth, obesity. So there are 4 risk factors. Okay, so pay attention to this. If you have any questions and you need to know more about, feel free to write questions, and don't forget to subscribe to my channel, and don't forget to share this with people, because guess what, lymphedema can be prevented in the early stage. If you start seeing signs of lymphedema, it can be prevented. But if you already got the diagnosis of lymphedema that it already has been swollen for a while, and physical therapy is going to help it to not getting worse. Okay. So I hope you like this video. It's a very good information for you. I want you to be aware because this is the newest research, and I want to share this with you and make you aware that things like that could be prevented if we find out earlier. Please talk with your physical therapy and doctor that they will help you to address it. Physical therapy has beautiful techniques like manual lymphatic drainage, exercises, stretching, the good tissue, also about skin care, about breathing techniques, a lot of good tools that's going to help you to prevent. Okay, my sweet people, thank you for watching this video. Have a beautiful day, and see you later with more videos. Bye bye.